What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy, and just having a great day so far. If you had to take a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Tuesday edition of the Virus Update for Tuesday, March 18th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Yes, there are a lot of viruses out there. Hey, measles, that's a virus from the past that we thought we had under control. Guess what? We no longer have it under control. In fact, I think we're about to pass the number of measles cases total for last year, and we're only in March with the rest of the year to go. Yeah, that's not a good thing. Hey, COVID, you're being told it's not a pandemic anymore. But let me tell you something. COVID is still out there. Yeah, you may know it's still out there, but you know what? It's actually worse than you think. There's a lot of people that are going on to develop long COVID, and COVID deaths are still a thing. And with data being so hidden, some of these COVID waves are being completely suppressed or not known about in many different areas. But have no fear. I am here to help you guide yourself through it all, to help keep you safe so you can make better risk assessment and all that stuff. Want to stay informed with the latest news and data? Just subscribe down below. Give this video a thumbs up. The more people that hit that thumbs up button, the more YouTube's going to push out this content. Of course, share this video with anyone you know. Hit that notification bell and leave your comments down below in our growing comment community. Already, we have several news stories today, including some international data that we are going to take a look at. Then we're going to take a look at a little bit of weekly data that has come in from my state in Pennsylvania. We're also going to take a look at some EMS data, which I'll tell you, it's a very busy morning for EMS around here. And we have to take a look at a state, and more importantly, a city that is currently having a problem with COVID. Yeah, remember, the national trend for COVID is dropping in the United States. But I found one city where that is just not the case. And in fact, things are quickly getting worse. I'll show you that a little later. And of course, we'll take a look at some wastewater data. I think we'll do each region of wastewater scan and maybe do one wastewater site within that region, depending on how much time we have left. Alrighty, starting off in the UK today, over in Europe, UK. Nearly 1 in 10 unsure if they have long COVID. Study finds. And, you know, I have a lot of problems with this. The fact that it even says 1 in 10 unsure if they have long COVID, it really should be made easier to figure out if someone has long COVID. And plus, there are so many people out there that just do not know what long COVID is. It can't be from COVID, this new problem. Yes, it can be. We've talked about this many times before. There are over 200 different symptoms of COVID, or long COVID. And the best way to figure out if it's long COVID, or at least my figuring, because there's no actual test. Did your problem exist before you had COVID? Did the problem start after you had a case of COVID? If something new is bothering you health-wise after a case of COVID, chances are it's related to the case of COVID that you have had. All right. This is according to a new study by the University of Southampton based on NHS England survey data from 2023. The research published in the journal Health Expectations also found that 4.8% of people reported having long COVID. The condition is more common among those living in deprived areas with specific ethnic backgrounds, parents, or carers, and those with other long-term conditions. So yes, long COVID is a real problem over in the UK as well, and many unsure if they even have it. Yeah, it's something that we really need to focus more energy on to help solve. And, you know, one big way to help solve the problem, or at least the future continuation of the problem, let's get down the number of infections. Let's just try and eliminate infections altogether. Doubt it'll ever happen, but heck, we could at least try. All right, this is kind of a disgusting story next, but I figured I would share it. Tracy Morgan apparently was sick at the Knicks game, and, well, you know, threw up all over the court. Yeah, take a look at this. Yeah, they had to clean up a mess. Don't know whether it was norovirus, what it was, but Yeah, not good. I actually briefly saw this game for like 30 seconds last night. I guess I missed this part of the game, and yikes. In San Bernardino, California, yes, we have more pediatric flu deaths to report. In fact, they now have 4. And we've been seeing this a lot this winter. I don't know that I was actually searching for these type stories a year ago when I was doing what was then called the pandemic update, but it seems to me like there are more this year. And, we do know this was a worse flu season than the previous one, so it just seems like there's far too many stories saying pediatric flu deaths in this state, that city, here, there. Way too many places. So, yeah, not a good thing. San Bernardino now says they have had 4 um, flu deaths, and get this, among the deceased children, 2 did not have any known medical conditions, while the other 2 had significant underlying conditions. Okay, significant underlying conditions. Those 2 should have really been protected from getting any virus at all, but now we're talking about 2 that didn't have any conditions. I wonder if those 2 were vaccinated or not. I mean, it's just bad. Just really bad that any kids have to die from flu. It's totally ridiculous. We should be protecting the children. Colorado Springs Elementary School dealing with 3 cases of chickenpox. Yeah, here's a virus we haven't talked about in a while. Multiple students at the Classical Academy Central Campus are sick with chickenpox. So, yep, that's it's another virus that is causing issues. All right, in case you did not know, maybe you're new here, or maybe you need a reminder. My website is datareport.info. It is loaded with information. I am going to be making some more posts there today, archiving some more things, and that's what it is. That is the main purpose of the website. Yes, it's a discussion forum, but anything that gets discussed and posted gets archived. So links to some of these news stories that you see here, maybe studies, past news stories, they get archived there, and you can go back and find them. And let me tell you something. I'm starting to get a little bit of attention here. Some of my tracking threads on Google are actually coming up in the beginning now. That's a good thing. People are starting to get made aware of just what's going on. When they click on something like list of performers sick, list of sports players sick, they say, whoa, I didn't know there's that many U.S. sports players that are sick, or international sports players that are sick. Yeah, people are starting to be made aware of what's going on, and that's a good thing. If enough people are made aware, maybe they'll start taking precautions again. I don't know. I'm just one person. I can't solve all the world's problems. Moving on now to Finland, where a norovirus outbreak in the Finnish parliament has infected dozens of people with a GI-like illness. 80 of them are confirmed GI-like illness, and you know what? There's also 8 of them that actually are confirmed to be norovirus, and among a survey, 240 people responded, 80 people are reporting symptoms. We'll have to keep an eye on this to see if this grows or if there's any updates to the story. Dennis, the COVID info guy. Queensland respiratory surveillance report from March 12th to March 18th shows COVID, 501 reported cases, that's up by 3.5%. Influenza, 928 cases, that's up by 34.2%. RSV, 590 cases, that's up by 62%. Hospitalizations, 73, that's down by 42.9%. Influenza, 74, that's up by 23.3%. RSV, 41, that's down by 22.6%. So, yes, some things are starting to rise over in Queensland, which is in Australia. It looks like influenza is continuing to rise. And as for cases, all 3 of these viruses did rise with that influenza rise in the hospitals. And taking a look at Italy now, I must advise you this data is not up to date. It is from last week, but you know what? We did not even give last week's update, and we do need to refresh this because for some reason this is not loading. There it goes. It finally loaded. Taking a look here. Cases in the last 30 days. 1,964, and this is for COVID. 35 cases among healthcare workers. 69 years old is the median age of cases in the last 30 days. Cases by sex. Males, 48.5%. Females, 41.5% in the last 30 days. 41 deaths have been reported in the last 30 days. And recovered, 1,311. So it's good to see the recovered number. But you know what? There's still a lot of people that have not recovered within that number. So yes, they are still seeing cases over in Italy, and we can see here asymptomatic cases, or a majority of them. Severe cases, the number of severe cases, take a look at that. It is actually, looks to be starting to increase a little bit, as is the number of mild cases. Actually, mild cases have dropped a little bit, but we can see here there's quite a few severe cases compared to before, but the number of critical cases has dropped at this time. That's a good thing. Taking a look at the viral activity levels in Canada, let's refresh this. Sometimes there's an update on Tuesdays. And COVID-19 is moderate. Flu A is moderate. Flu B is moderate at this time. And RSV is listed in the high category. Taking a look at air qualities, and you're going to be happy to see that for many places in the United States, air qualities are doing pretty well today. But it's the West Coast that is having problems today, and portions of the Northern Plains. But look at California. We're seeing a lot of yellow, a lot of red. Yeah, that's just not good. And a few problem areas in the Pacific Northwest as well. Not good to see that. Taking a look at what's going on with the pollen levels today, and we are seeing red show up in a lot of places. That does include right here in my own backyard, Philadelphia area. Yep, we're starting to see some red. And generally, south of Interstate 70. Yeah, take a look at this. A lot of red showing up today in the southeast. Texas is completely red again. That's not good. Median pollen levels showing up today up in portions of the Pacific Northwest in some of these areas. There are also some low areas mixed in, so that's not good. Four Corners region continues to get worse. It's that time of year. You need to start taking your allergy medicine once again if you do have allergy problems. Taking a look at what's going on in Pinellas County, Florida, and we do see several sick person calls. Yikes. 1, 2, 3, 4, 5, 6, 7 sick person calls. We're going to be taking a look at wastewater in the southeast, and I think we will make a stop off in Florida. Maybe we'll go right into this area, which would be about the Clearwater, St. Petersburg, Tampa Bay area. Yeah, I think we're going to take a look at that, because that's a lot of sick person calls. Let's see if we can find any virus that may be going upward. Philadelphia yesterday, 776 EMS incidents. Doing a live look in here at Montgomery County. Let me refresh this to make sure that's up to date. Yeah, there's a lot of calls right now, and oh my, I'm seeing not one. There's cardiac arrest in Norristown, Pennsylvania. Then you come down to Upper Moreland, Pennsylvania, also a cardiac arrest call. And let's see here. No, it is not translating to the fire department. Sometimes the fire department also gets called out, what's known as quick response service, or they'll just send a regular fire engine out. I've seen it many of times if it's really serious. I'm seeing multiple strokes here, respiratory emergency. Yeah, really busy. I hope Chester County is less busy, because it's been busy all morning. And chances are, no, it is not. Wow, this is not good. There have been, so many strokes this morning in Chester County. First off, sick person showing up. 1, 2, seeing 2 sick person calls. Respiratory difficulty. Look at this. 1, 2, 3, 4 strokes right now. That is not good. And it's been above 3 strokes at any given time for like the last several hours now. Yeah, this is not good. I don't know what's going on. Are we post-COVID from the winter wave, or is it just, I don't know. This is not good that we're seeing all these serious calls. Just saw Montgomery County with multiple strokes, multiple cardiac arrests. We're also seeing heart problems show up here. Yeah, not a good thing whatsoever. And tell you what, this is not good either. The hospitals in Pennsylvania, in eastern Pennsylvania, we'll say Susquehanna River on eastward, yeah, they're getting busy once again. You're seeing a lot of yellow here. South central Pennsylvania, York. Let's find out what's going on there. Emergency department overcrowding. How about Carlisle, Pennsylvania? That's a behavioral health issue, but you do now see southeast Pennsylvania. 2 hospitals, once again, are coming up into yellow. That is not good at all. Lehigh Valley does have several hospitals with issues. Then you go up to Reading, there's a hospital with an issue there, and that's a behavioral health diversion. Then you come up here to Geisinger, St. Luke's. That's overcrowding. And then we go way up north to just north of Scranton, and we do see Dixon City, Lehigh Valley Hospital. Stroke diversion at this time. Yeah, what is going on with all these strokes in Pennsylvania today? Not good whatsoever. St. Luke's Monroe campus, emergency department overcrowding. Let's hope we see some better news in New Jersey. I'm going to refresh this. Let's see what's going on here. We do see a couple hospitals dealing with issues, and here's another one. Inspira Medical Center in Malka Hill, that has a critical care issue. All right, Pennsylvania did update for some things today, and activity through March 15th, week 11. Influenza trends. Influenza activity is high, but continues to decrease. 205,953 laboratory confirmed influenza cases have been reported season to date. That's going back to September. That's a lot of cases of flu, because you have to remember, there's so many people that just won't bother to get tested. They'll say, oh, I just have a cold. I don't need to get tested. I'll be fine. All these stupid excuses. Plus, we do have the, I hate using that word stupid. That's not a nice word to say. Plus, we do have at-home testing, which does not get reported. I apologize for saying that S word I just said. The percent of emergency department visits resulting in influenza diagnosis is decreasing for all ages statewide, but is still higher in the 0 to 4 and 5 to 24 age groups. As of 3-8, new hospital admissions for influenza were decreasing for adult and pediatric patients. 771 influenza-related deaths have been reported in Pennsylvania residents by the National Center for Health Statistics. We'll have to see if that number gets to 1,000 this year. I don't know if it will or not. Alrighty, let's pause for a second. Let's take that hydration break. I need one, and I'm sure you probably need one as well. Today's drink of choice, water. I try to keep it water for most of these updates. Alrighty, isn't that refreshing? It'll especially be more refreshing as we start to come into the warmer months and dehydration can happen faster. Alrighty, RSV trends in Pennsylvania. RSV activity in Pennsylvania is decreasing. 43,668 laboratory confirmed RSV cases have been reported season to date. The percent of emergency department visits resulting in an RSV diagnosis are decreasing statewide for all ages. As of 3-8, new hospital admissions for RSV are still decreasing for adult patients, and this is not good, slightly increasing for pediatric patients. And I think you'll see, Wastewater is rising for that. COVID-19 trends. The percent of emergency department visits with a COVID-19 diagnosis are low statewide for all ages. As of 3-8, new hospital admissions for COVID-19 are decreasing for adults and are low for pediatric patients. 991 COVID-19 related deaths have been reported in Pennsylvania residents by the National Center for Health Statistics for this virus season. That number will go over 1,000. So you see it there, folks. 991 COVID, 771 influenza. Still more deaths in Pennsylvania related to COVID than influenza. All right, taking a look at what's going on with wastewater real quickly, and let me move myself here if I can so you can see this chart. COVID at this time is decreasing, and when we take a look at what's going on with the latest variants, we see here LP.8.1 at this time is the dominant variant. Influenza at this time, gonna bounce myself back again so you can see this. Influenza at this time in wastewater has gone up slightly, so that's not good. And take a look at what's going on with RSV, and can I do this without having to? There we go. We can see with RSV, RSV has actually gone up slightly, and we do know pediatric cases are rising slightly in Pennsylvania. We'll do a deeper look at this and some of the other things in Pennsylvania another day later in the week, because we do have several more things I did want to look at today. All right, I have to show you this. You've probably been wondering, I said there's a major area that's starting to go up. Yeah, it's New York State, but there's a reason why New York State's going up. New York City, something is going on. We need some new variant testing in New York City, because something is just not going right in New York City. 730 positive cases. You can see the average trend. It is starting to go upward now. You can clearly see it here. It is trending upward, and the 7-day average per 100,000 is now up to 5.5. It was down to 4.9 cases. So, that's going up, and it's not stopping there. Hospitalizations are going up as well. Take a look at New York City. Since I have New York City, actually, no, it's going to show you statewide. Okay, statewide hospitalizations did go up today. 755 and 88 people in the ICU. And I got to mention something. You can see here, we have not come down a whole lot. Yeah, it's come down from the winter peak around the holidays, but we have not come down a whole lot in New York State. And to be honest with you, going back to cases, this is a really high baseline to start off. If it's going to be another wave, I'm not saying it is, but if it is going to be another wave, this would be a really high point to start off with, much higher than where the winter wave started off with. So this is obviously concerning, and what I'm about to show you next is even more concerning. Take a look at New York City. As you know, New York City, for the most part, has been rising throughout the winter. We had thought on February 27th that data report for that particular day was the peak and was starting to drop. Looked like it. Now, all of a sudden, look at this. There is a big increase today. Yesterday's report showed 325 hospitalizations in New York City, 33 people in the ICU. Today, that went up. 356 people hospitalized, 49 people in the ICU. That's a pretty big increase, one that is relatively concerning at this time. Yeah, I don't like seeing that, so this is something we're going to have to continue to watch very closely, because definitely something could be going on in New York City at this time, which I think is why we're seeing the whole region go up. But I'm pretty sure, was it the capital region? Hang on, I'm going to get it here. No, it was not the capital region. There was another region in New York State. Yes, Central New York. Take a look at this. Yeah, that's all a big increase as well. They have 29 hospitalized. Just the previous report was 23. So, yeah, that's going up. And let's just take a look at hospital admissions. You can see that went up in the central region. New York City hospital admissions, yeah, that went way up. And let's take a look at the statewide level here. See, hospital admissions, big increase. Look at that. It pushed the average charges to go almost straight upwards. So that's not good. This is something we're going to continue to follow. Take a look at the United States when it comes to emergency department visits diagnosed with COVID. You can see that's starting to drop more. But again, I highly stress there's several accounts, and this goes along with what I just showed you. There's several accounts that will talk about the national and regional trends. Yes, it is good to look at that. But if you're trying to make a risk assessment, when should I schedule my doctor's appointment? Say you live in New York City. Well, guess what? You're not following the national trend right now. Take a look at this. I'm going to switch this to New York State. And watch this. You see here, National Emergency Department visits diagnosed with COVID. They're dropping. When we click on New York State, look at that. New York State's not following the national trend. Yeah, it started dropping more nationally. New York State, probably because of New York City and maybe a couple other regions in New York State. Yeah, look at that. It's starting to go up again. And I should mention, with New York City, that rise there, it is not being seen just yet on Long Island in the hospitals. So, yeah, here you go. Perfect point to be made. And I made a post about this on X and Blue Sky. When making local risk assessment, do not go by what the national trend is to say, oh, well, national trend's dropping, must be safe in my community. No. Check and see if there's any data, wastewater data, or anything that tells you what's going on in your local area. Walgreens' COVID positivity rate this week was 13.7%. When we take a look at what the rate was for flu, it was 6.68%. Remember, all this is from testing done at Walgreens and does not represent what the CDC or anything else, maybe your state dashboard, would show. All right, I wanted to take a look region by region. This video is going pretty long. And you know what? We'll still do it anyhow. I'll give you a longer video today. Nationwide, you're going to see some wonky movements, less of those wonky movements when we go to the regions. COVID, if you exit out this wonky movement, maybe a little bit of an increase. Maybe not a drop, or maybe a flattening. Can't say it's going down anymore. This wonky movement will get corrected. The level is medium. RSV is high. Influenza A is high. Influenza B is low. HMPV is low. EVD68 is low. Norovirus is high at this time. I'm just going to basically read off the levels here. Midwest is high at this time for COVID. RSV is still high. Influenza A is high. Influenza B is low. HMPV is low. EVD68 is low. Norovirus is high at this time. In the Northeast, we do see that Northeast is medium. For COVID, RSV is high. Influenza A is high. Influenza B is high. HMPV is high. EVD68 is low. And Norovirus is still listed in the high category at this time. In the South, and we're going to make a stop off here in the South. And you know what? I think we'll make a stop off in the West Coast as well. We didn't talk much about the West Coast today, and I need to make you guys feel like you're included in this video. In the South, we do see that COVID is high, and yeah, it's starting to rise. Remember, spring break. I just wanted to mention that because we're not seeing, or at least so far, we're not seeing the other regions rise for COVID. RSV is high. Influenza A is still listed high. That drop has slowed down. That's not good. We would like to see that drop more. Influenza B is low but rising. HMPV is low. EBD68 is low. Norovirus is high at this time. And you know what? If that wonky movement was removed, it probably would be rising once again. All right, let's go down to Florida as promised. And we can come out here to St. Petersburg area. And let's do the northeast one. I forget which one's the bigger wastewater site, but you see here, COVID is rising slightly. RSV is still high but dropping. Influenza A is still high. Influenza B is low. HMPV, EVD68 is low. Look at norovirus. Norovirus is starting to rise. That could be one of the reasons for more sickness calls. No Mpox at this time. And you know what? Let's stick with this for a second. Let's see if there's any trends going on in the other region. Southwest wastewater site is low for COVID, but rising at this time. RSV is high and dropping. Influenza A, that's still high, and you know what? I mean, it did come down, but it's leveled off. We'll see if that gets changed to maybe medium. I don't know. It looks like it really has dropped. Influenza B is low. HMPV is low. Norovirus has leveled off after being oh so high back around the holidays, and the other viruses are not an issue at this time. And we might as well take a look at the northwest side of town. And we can see here, COVID is low. RSV, that's gone up a little bit. That's not good to see. Influenza A still listed high. Influenza B is low. HMPV is low. EVD68 is low. Norovirus still high, needs to come down more. And everything else is fine at this time. All right, in the west, taking a look at the levels there, we can see the west coast for COVID is low. And I honestly cannot get a read of what direction this is going. All these movements, we'll have to see what happens with the correction. RSV is still listed at high. Influenza A is high. Influenza B is high. And take away some of these wonky movements, I don't know. Is that a rise again? Let's wait for the correction. HMPV. We don't need to wait for a correction for this. This is trending upward. EBD68 is trending upward. And norovirus is still listed high at this time. Let's go down to, how about we come down to San Diego today and see what's going on there. In San Diego, COVID is listed at low at this time. RSV is high. Both of those look to be rising a little bit. Influenza A is medium. Influenza B is low. HMPV is low. EVD68 is low. Norovirus is medium. Hepatitis A, some detections of that. And can we do anywhere in the Pacific Northwest on here? If not, I will quickly go over to, now, it's not worth it to take a look. I'm going to quickly go over to the wastewater site from the CDC. I'm giving you a little bonus content here. And let's take a look at the wastewater map from the CDC. And let's zoom into the northwest. And we can see here, for the most part, when we take a look at COVID here, remember, blues, the dark blues are really low levels. And that is just what we're seeing here. Only one orange site in the state of Oregon. So good to see that at this time. And I can tell you that when it comes to flu in Washington State, it's still listed in the high category at this time. We need to see those levels come down more. In fact, I'm just going to click on it. I'm pretty sure it's still listed high there. And let's change this to state trends. And let's take a look at what's going on in Washington. I believe it's still listed in the high. It may even be listed very high. No, still listed in the high category. There are still some wastewater sites there, though, in the Seattle area that are still listed very high at this time. Alrighty, folks, this was a really long update today. If you enjoyed this update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and leave your comments down below. I will see you all again next time. Hopefully tomorrow we'll have an update on the Texas measles outbreak. Haven't seen that yet today. We've recorded earlier today, although you're seeing this later in the day. So we'll have to see if there's an update on that. And of course, we're going to be keeping a close eye on what is going on in New York City. Yeah, that is a developing, concerning story. Because remember, they're starting off at a really high level there. If that is indeed another rise, hopefully that's just something, maybe 1 or 2 days, and it drops. I don't know. We'll be following it. Alrighty, see you guys all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday afternoon. Thanks for watching.